Codeine. It's a name we've all heard, right? It's in painkillers, it's in cough syrups. It just seems like a standard, maybe even kind of mild medication. But what if I told you that inside this very common drug, there's a hidden risk, a genetic lottery that most of us have absolutely no idea we're even playing? So let's just get right to it. Is codeine a helpful medicine, or is it a deadly poison? Well, the wild part is, it can be both. So why? How is that even possible? How can one drug be so incredibly different depending on who takes it? The answer isn't in the pill itself. It's all about the secret chemistry that's happening inside our own bodies. Let's dive in. Okay, first things first, let's cover the basics, what we all think we know. Codeine has been a go-to tool for doctors for a very, very long time, mostly for two really common problems: pain and coughing. So what is codeine really? It's what we call an opiate, which means it comes directly from nature, specifically from the opium poppy. It's actually one of the oldest opioids we know of, and its power is in its ability to relieve pain and to quiet a really bad cough. Now, in the real world, you'll almost never see codeine prescribed by itself for pain. It's usually combined with something like Tylenol or ibuprofen to kind of boost its effectiveness. And for coughs, yeah, this isn't for your average cold. It's a powerful suppressant that's saved for those really severe dry coughs when literally nothing else is working. But this is where the story takes a huge turn. The relief that you feel from codeine, it's not actually from the codeine at all. To understand its real power, we have to look at its disguise. And this one word, prodrug, this is the key to the entire mystery. Think of a prodrug like a locked box. You swallow it, but it's totally inactive. Your own body has to have the right key to unlock its true power. So here's how that works. You take codeine, it travels to your liver, and then this one special enzyme called CYP2D6 gets to work. And its only job is to turn that codeine into morphine. That's right. The codeine you take literally becomes morphine inside your body. So when you feel that pain relief, it's not the codeine doing the work. It's the morphine that your body just created that's latching onto your brain's opioid receptors and shutting down the pain. Codeine is just the delivery system. And this brings us right back to our original question. Why is it a helpful medicine for one person and a poison for another? The answer isn't in the drug. It's in our DNA. It's a genetic lottery. Remember that enzyme CYP2D6? Well, how well that enzyme works is different for every single person. Your own genetics decide how fast and how well you make that codeine to morphine conversion. And that, my friends, dictates everything. So this is the crucial part. We all basically fall into three groups. First, you have poor metabolizers. Their enzyme is super slow, so codeine does almost nothing for them, no pain relief. Then there are extensive metabolizers. This is most of us. We have a normal enzyme and we get the expected pain relief. But then you have the ultra-rapid metabolizers. Their enzymes are hyperactive. They turn a normal dose of codeine into a massive, dangerous flood of morphine. And that is exactly how a normal dose can lead to an overdose. Okay, so now that we get this hidden mechanism, we can really start to understand the range of side effects, which go from simply unpleasant to, well, absolutely life-threatening. The common side effects are probably what you'd expect from an opioid: drowsiness, feeling dizzy, maybe some nausea, and constipation. These are the typical reactions a lot of people might get, and they're usually manageable. But the single most dangerous risk is terrifyingly simple: respiratory depression. The morphine slows your breathing down. For an ultra-rapid metabolizer, that slowing down can become a complete stop. And these are the warning signs that things are going very, very wrong. We're talking extreme sleepiness, tiny pinpoint pupils, cold and clammy skin, and shallow breathing. These are all huge red flags for a codeine overdose. You know, with any opioid, there are two terms that get confused all the time, and it's so important to know the difference. Physical dependence is when your body just gets used to the drug and you'll get withdrawal symptoms if you stop. But addiction is different. That's a brain disease. It involves compulsive drug seeking, even when it's causing serious harm. And codeine can absolutely lead to both. And of course, you can't talk about any opioid today without recognizing its role in the larger opioid crisis. Codeine's reputation as a milder drug is exactly what has made it part of the problem. Because it's seen as less intense than something like oxycodone, it can act as a gateway.
Someone might start with a codeine-based prescription, and as their tolerance builds, they start looking for stronger, more dangerous opioids.
You can see this really clearly in the recreational misuse of something called lean or purple drink. This mix of prescription-strength codeine cough syrup, soda, and candy has been glorified in pop culture, and it has led to so many overdoses and deaths, especially among young people. Which brings us right back to the central, very personal question. Without a specific genetic test, you have no way of knowing if you're a poor, normal, or ultra-rapid metabolizer. So the next time you see that common drug, you have to ask yourself, is this a lottery you're willing to play?